Well, I went to medical school here in Alabama and wanted to stay close by, really liked the area and the people. So applied to South Alabama. At that time we were doing in-person interviews, and I came in person, interviewed, really enjoyed both the hospital and the staff. I felt like of all the interviews I did, coming here, seeing the APDs, they actually had read through my application, my CV and everything, and had very personal questions. And that was important to me because I've always wanted to go somewhere where I felt wanted and valued.
I feel like this program is really good about pushing you out of your comfort zone. They give you just enough autonomy to let you make your own decisions and feel like you're part of taking care of the patients yourself.
When I was looking at different list of programs, I was looking at three things. A program that focuses on research and academic activities, high quality education, good work-life balance, and a program where every single resident matters. South has been sending residents and faculty members every year to different research conferences. USA has been providing not only educational, but also a lot of financial support to all those academic activities.
Any prospective residents should be aware that this is a program that will prioritize them and their health and their wellness. I think they need to understand that, you know, it's gonna be tough because all residencies have tough aspects, but they will care for you, they will guide you, they will make sure that you're comfortable and supervised until you can fly on your own, and they will help you grow. They will help you grow and become a better physician.
Pretty much every attendee, and I have their cell phone numbers if I have a question, if they're not directly next to me. There's never been a time where I haven't been able to approach them about a question, even if it's silly to me. It's not silly to them, and they take pretty much all our questions seriously.
Really, it's the culture of the program is what makes us unique. This is a place where the residents work in a very collaborative environment. They're very supportive of each other, and I think the faculty really gets to know them very well and is equally supportive of the residents as they are of each other. We have 4 fellowships here. We have pulmonary critical care, cardiology, gastroenterology, and then hematology oncology. But that's not to say that those are the only fellowships that our residents pursue. We've had people do infectious disease, nephrology, rheumatology, so really any of the medical subspecialties you can get prepared and be successful in matching with those. But then we also have some of our residents that choose not to go on to fellowship training, and they may choose hospitalist medicine or primary care where they're working in the ambulatory setting.
Every Friday we have case conference, which is what you attended, and that is a weekly time where we take a case that has come through the medicine department and we dissect it as a program. Some cases are really challenging to come to a diagnosis, so we go ahead and do a broad differential. What could this be? What could kill the patient? What else is most likely? And we kind of go through step by step. Some things are pretty obvious, but are kind of challenging to treat. And so instead of spending all that time going through all the millions of possibilities it could be, we talk through the steps of treating these diseases.
This area is very underserved, and what ends up happening is you see patients that have disease for a long time that have not been treated, and that is what presents to you, and it kind of forces you to tackle an advanced disease process right from the get-go.
We are kind of the region's academic center, and that provides a lot of patients coming into us. It lets you see a lot of different pathology, and that's important for your training. If you don't see something, it's really hard to get good at treating it.
Which I think training in that scenario will make me a better doctor in the future, because if I can care for patients here who are extremely sick and have extremely difficult social situations, then hopefully once I get out into practice, I can tackle anything that's thrown at me.
I love Mobile. I love it. I come from a very big city, and moving here was a big change, and it has a lot of positive aspects. I love that. You know, it's very cliche, but it is kind of like a small town with a big city vibe.
Downtown has just a smorgasbord of places to go.
You can kayak, you can canoe. There's obviously bird migrations that come through, alligators. There is a lot of nature that maybe you wouldn't necessarily expect being here in Mobile.
So we are the original Mardi Gras. We might not be the biggest, but we are the original Mardi Gras. Maybe ours tends to be a little more family friendly here in Mobile, and it's definitely a lot of fun for our residents to be able to go down and go to the parades or go to some of the balls.
We got beaches nearby. The weather is nice, so I think that's all you can ask for.